Hi everyone, thanks for taking some time to be with us today and watch this short video. I'm Dr. Leonie White and this is Dr. Kate Owen, and we wanted to make this video today because we had such a great response to the Facebook post that we did on our Queensland Institute of Family Therapy page, where we talked about multiple amygdalas and what happens when multiple amygdalas get together and meet, and sometimes when multiple amygdalas are taking over at the one time. So we thought we'd do this video, we'd talk about a few concepts, maybe see if we could even deepen the knowledge and understanding from that post a little bit.
Absolutely. So one of the important concepts that we all need to be on the same page about from the start is, what is an amygdala?
What is an amygdala, Kate?
So Dr. Karen Young has created some plushies and a wonderful book called Hey Warrior to describe to children what an amygdala is and what it does. But I have to tell you, it's not just for kids, it's for everybody. Everybody on the planet has an amygdala. Now, the amygdala is inside the brain. It's very small. It is the shape of an almond. And this is why it's in the shape of an almond here. The one job that your amygdala has to do is protect you. And this is why Karen has called her plushies in her book, Hey Warrior, because it is a warrior that gives you energy to have to run or fight or do whatever you need to do if you feel that there's a threat in the environment. And so everybody has an amygdala. Its one job is to protect you. It's like a smoke alarm. A smoke alarm will set off even if there's a whiff of smoke. The smoke alarm doesn't care if there's a real fire or if there's just the threat of a fire, and that's what your amygdala does. It goes off if there's any threat in the environment. So what happens then if we have a whole bunch of amygdalas on the lookout to protect people when you walk into a family therapy session?
Well, as part of understanding that, I'd really like to also think about the relationship between our amygdalas and our thinking brains.
Great idea.
Yeah, so normally it's our thinking brains that we need to keep us calm, to think things through, have that emotional regulation and control. So if we think about the hand model of the brain, with the brain being our fist and our amygdala being the little almond right inside, less developed from an evolutionary perspective than the smarter thinking part of the brain, which is up here. And so when that smoke alarm goes off and people are thinking, well, they're not even thinking, it's an automatic reaction, and the warrior comes out. Sometimes what can happen is the warrior can be so strong and powerful in protection that we flip our lids.
Absolutely.
And so when our lids are flipped, that means that the amygdala is running the show, not our thoughtful, reflective part of the brain. And so we might be thinking about how to get that part back online.
Because we have lids flipping.
Yes.
And as part of the therapeutic process, we need to help to be able to get that back working again.
Absolutely.
Okay.
So let's look at what that looks like in a family therapy session.
Yes.
And we know, especially if people have watched our other videos, that a family therapy session doesn't mean we always have a whole family in the room.
That's right.
We could be doing a family therapy session with one person in the room.
Absolutely.
So let's have a little look at our therapy session. So we have our therapist, and we have a woman here who's a mum and a wife. And this means that we've got two amygdalas in the room already. What do I mean, two amygdalas? Well, we have one amygdala for mum who's come for help. And we also have an amygdala for the therapist.
Absolutely.
Yeah. And Kate, I'm just wondering, would it be good to talk a little bit about why the therapist's amygdala is so important as well?
Absolutely.
Yeah.
So with everybody's brain is continuously scanning the environment. And that is the same for therapists. When you walk into a counselling session, your brain is doing the exact same things as your clients. Now, the thing with therapists is that your clients will be very attuned to how, what is this person thinking about me? What are the nonverbal signals that the client's picking up on? And so it's very important as a therapist that you can go into that therapeutic space very centered, very grounded, and very calm, because amygdalas actually talk to one another.
Yeah, they sure do.
They do. Brains talk to one another. And so if the therapist brain is nice and soothed and calm, it has a beautiful communication with the client's brain.
Yep.
Now, one of the important concepts here is something called mirror neurons,
Mm-hmm.
which basically means that our brains want to reflect what we see in our environment.
Yep.
So if this client here looks over to the therapist and the therapist's brain and their amygdala is soothed, then the mirror neurons will want to reflect what that client sees.
So I guess what you're saying is that as the therapist, when we are calm, we can offer that calm to our clients. And if they're starting to feel distressed, in offering that calm, we might be able to help them to downregulate and be able to feel safe enough to engage in a therapy session.
Absolutely. Calm is contagious just as much as anxiety is. And so it's you are your best down-regulating tool.
Great.
Now, what happens when we add more amygdalas into the mix?
Well, let's have a look. Okay. So you might work with couples. Or you might work with one adult who decides to bring their partner in for support.
Mm-hmm.
Either way, we've now got 3 amygdalas in the room.
So I'll take this one.
Thank you. So we've got mum with her amygdala, we've got dad with his amygdala, and we still have our therapist's amygdala too.
Yep.
We need to be thinking about.
That's right.
Great.
And so, Leonie, in your experience then,
Yeah.
where, having your systemic hat on, then how can, let's say, activated amygdalas, how could that present in a therapy session? What would we see?
Great question. I'm going to put this little guy down so I can use my hands.
Mm-hmm.
So often what I would see in a counselling session in a therapy room, especially when we're talking about really touchy topics, maybe it's a difference of opinion about how to discipline or raise a child.
Mm-hmm.
Maybe there's some anxiety in the relationship and some concern around whether there's security in the relationship.
Mm-hmm.
Maybe people are doing great, but they've just faced so many stressors. Maybe someone's lost their job, maybe one of the kids is getting a tough time at school, and so the pressure builds.
Yeah.
And our warriors are at the ready to come out.
Oh, yeah.
And so even inside the therapy room,
Mm-hmm.
someone may start to get a bit stressed,
Mm-hmm.
and the interaction might be a little bit tense,
Mm-hmm.
and then someone's worry will take over.
Yes.
And what will happen is their lid will flip.
Yep.
And so warrior, middle part of the brain, starts to drive the interaction. And you might see that either with someone being maybe a bit defensive or aggressive. You might see that actually as someone wanting to hide or withdraw.
Yes.
You might see that as someone just picking a fight in a different direction.
Those classic fight, flight, freeze responses?
Yeah, absolutely.
Yeah.
And so we know then that the thinking part of the brain that is used to calm down and think things through and be able to talk things through in a really regulated, connected way, it's not working. So then what happens?
Yes.
One brain is
Yes.
flipped, and we know that anxiety and tension can be contagious.
Yes.
Then what happens is the other person, in this case mum, she starts to feel really stressed and her warrior jumps on board.
Yes.
And so mum flips her lid and her amygdala is running the show.
Yes.
And then we might see maybe some arguing back, maybe some statements that might show contempt or something that's a bit damaging to the relationship.
Yes.
And it's just those warriors trying to protect their people,
Yes.
but doing it in ways that aren't really helpful for themselves or for their relationship.
Okay.
And so what we need to do is think about, how do we get amygdalas back online?
And so could you talk me through some ideas around the therapist? And we touched on these before with a little bit of education.
Yeah.
But, what could the therapist be doing? What's their, I guess, role, part of the process?
Yeah, absolutely. And so this comes up a lot, especially in supervision and training, especially for people who are new to family therapy or working with more than one person in the room. and they're saying, oh my gosh, I don't know what to do. These people are really stressed and activated. I feel really stressed and activated.
Yes.
And so the absolute very first and most important thing they can do
Yes.
is soothe their own amygdala.
Absolutely.
That is the first amygdala that needs to come back online
Yes.
or be online and stay online enough to be able to start to offer that soothing, calming environment.
Wonderful, wonderful. And then to add on to that, as the therapist does that in the moment, because that is needed and the amygdalas are soothed, then if this is maybe a stressed out family or a family with a lot of tension and conflict going on, then how can we as systemic practitioners use this information, not just in the moment, but actually as a part of therapy and goals for therapy?
Absolutely. I love this question, and I love it also because I don't always get both parts of a couple in a room, and I also don't always get the whole family in the room. But one of the really terrific family therapy concepts is the idea of circularity or reciprocity. And so if we're in an interaction together, I affect you, and I'm also affected by you. And so we have this circularity of our interaction. Now, this means that I don't have to soothe all these amygdalas all at once. I might work with one person, or I might start with one person in the room, and we, depending on, what works for my client, what's a good fit for them, we might start with some psychoeducation. I might read them Karen's book. Some people like more a real science-based approach. They really want to understand at an intellectual level what's going on. Some people are more body-based. And so they might want to learn some skills or strategies for soothing their body, maybe some deep breathing, maybe some mindful attention, some other grounding strategies. And if I can get traction even with just one person, that will, because one person affects the next who affects them, that will start to impact the family environment.
And so we have an extra little person over there. So if we could imagine that sometimes we don't get everyone, and this is the teenager who is refusing to come into the therapy session. And so as Leonie was explaining, as the therapist can work with stressed out, let's say parent or parents, and as they start to soothe, then they take their calmed amygdalas and that information on knowing how to soothe, and then they take it back into the home environment as well.
That's great.
And this reminds me of good old classic, Bowen family systems therapy. And one of the key elements in that therapy is around emotional maturity, but being soothed enough to know what your position is in the world. So I just love the way that this neuroscience integrates with systemic practice and different family therapy concepts.
I think definitely, because if we can support or coach individuals, if not whole families, but if we can even support and coach one individual to be able to manage their brain and body so that they can take that moment and decide how to act in a way that's consistent with their values and principles for life. And maybe that is just being generous in a relationship with someone in terms of the interaction, and being kind and gracious, then that's a start, and it's a really great start.
It is. And so one final word from me, and then you can have a final word too, is that one of the things that we love to do as the directors of the Queensland Institute of Family Therapy is we love to teach, but also what we like to do is the therapists with their amygdalas, they come and they get supervision. And so the calmer our amygdalas are, and we can hold that space for our supervisees, then again the circularity, they can go back into their working context and the ripple effect from there.
Thank you.
Any final words from you?
So my final word would be that one of the other things we love to do is integrate playfulness and also integrate great resources into our practice and our supervision and teaching. And so I always find that when I can make something concrete for the clients that I'm working with, they can hold on to it a bit better. And so I love to make concepts really concrete and also be able to share that with the other professionals that I'm working with.
Wonderful.
So
well, we might sign off from here.
So I hope that was useful, and feel free as well to share this information. As Kate was saying at the start, this is a video for professionals, but also something that if you think it's helpful and useful for the people you're working with, please feel free to use this.
Okay, well, thanks very much.
Okay, bye.